if you are in a small clinic chain, what the standard of care is that you want the AI agent to automate. If you don't know, then that's a problem. And so for our practices, that has been our number one limiting factor, is getting people's time to tell us what the processes are. It ends up becoming a very, very huge limiting factor for success.
Well, James, thanks for hopping on today's podcast. Really excited to speak to you today and learn about your work at AdviNOW Medical. First, I know you've launched and led companies across multiple industries. We were just talking about that. What was the insight that led you to start AdviNOW?
Yeah, Bert, I appreciate you having me on the podcast. You know, my previous job was in the semiconductor automotive space, and we made advanced driver assisted systems. So anything that does auto brake or auto steer, or in other words, self-driving vehicle technologies, my company dominated. And so we had about 80% market share of that space. And when we sold the business, as an officer of the company, it was a great time for me to retire. But I had a very strong non-compete, which meant I had to do something completely different. Well, completely different is very easy to say. It's kind of hard to do. You know, you can do anything you want except anything that you've ever done. And so, and so I started looking at healthcare thinking, okay, well, healthcare seems broken. There's got to be something that I can do. Well, when I dug into it, I thought, you know what, the easiest thing, I'll just buy some medical practices. I buy a bunch of practices, roll them up, and then run them, as businesses. Mm-hmm. Well, the more I dug into the medical practices, the more I was shocked about what really terrible businesses they were. All of these medical practices operated at low single-digit profitability. And you never want to own a business that makes like 3% profit, because then you're taking all the risk, and you can make that same profit by buying a government T-bill. It's really, really low risk type of numbers. Yet if that's all the profit you're making, then if anything goes wrong with the business, you take all that risk. Right. So it didn't make sense for me, and I couldn't square the circle. So I decided to walk away, and I had looked at about 30 different entities, practice groups. And I spent a good amount of time with a small number of them. So I went back to the guys I spent a lot of time with and said, thanks, but no thanks. I'm going to have to figure out something else I'm going to do. Well, one of the guys that I was talking to said, look, James, I know my business sucks. I don't need you to tell me. And I'm like, okay, sorry about that. Thanks. He goes, but why don't you come help me fix it? So that was my first opportunity to actually dive in and get to know medical practices in detail. But my approach was very different than what other people may approach it as. I mean, my previous company, I had a factory of 7,000 people that I was responsible for. I spent a lot of time doing cost reductions of that factory, time and motion studies. What do you have to do to pull cost out? And so I figured, well, let's do a very detailed time and motion study of the medical practice. So I came in with a stopwatch and just started timing exactly how long every movement took in the practice. Wow. Well, besides, making all the doctors and nurses and front desk people very nervous about having some guy in there timing all of their work, I realized a very important thing. And that is that doctors were spending 70% of their time inside the practice doing things that had nothing to do with their medical license. And it was just astonishing to me. I mean, the doctor's the moneymaker. They're the ones that should have their time optimized. Yet 70% of their time is spent doing things that had nothing to do with their medical license. In my previous life, it'd be like taking your highest paid engineer, a guy you're paying $500,000 a year to, and putting him on the assembly line for 2/3 of his day. I mean, no one in their right mind would do that. Yet in healthcare, that is what we are doing. Wow. So I dug into, why are physicians spending so much of their time doing this? Well, it comes down to this activity that they do requires medical knowledge. It doesn't require medical licensure, but it requires you actually understand medicine. It also requires insurance company knowledge. Medicare pays this, Medicaid pays this, United Healthcare pays this. Well, Doctors get that experience by practicing medicine, and no one else does. Then you need regulatory knowledge. Doctors know in, Arizona, this is the workflow required, in California, because they have to get licenses and they have to pass the boards in each one of these states. Thus, they are the ones who get stuck doing clerical work because they have that knowledge. Well, artificial intelligence can have knowledge as well. And so I looked at it and thought, wow, a very sophisticated artificial intelligence can actually eliminate all of the work a doctor does that they do that's not required by their license. And you can actually make that doctor efficient. So a little bit of a long story, but that's how we pivoted from self-driving vehicles to healthcare automation.
Yeah, no, I love that backstory, and the fact that you did that time and motion study with the stopwatch and the practice to figure out, like you said, 70% of the time is spent doing things that aren't tied to that medical practice, which is pretty astonishing. Talk to me a little bit about some of those problems that you saw in some of these clinics, like urgent care, like high volume clinics, that made it the right place to bring that artificial intelligence in. What were some of those specific problem areas? Because 70% of the time is a lot of time, What in that 70% was salient to you?
Well, so first, AdviNOW can be used in any medical practice. It's not just high volume urgent care clinics. It could be any medical practice actually has these exact same problems. So it's not just a high volume. It could be low volume surgical. And now doctors who do surgeries all day, they have a whole team that preps all the paperwork and does everything else for them. But guess what? They are still doing a lot of things that have nothing to do with their medical license. So the beautiful thing about AdviNOW is it's not just any specific practice. It's anybody that does a medical encounter can see value. So where does that break down into? Well, when you do the time and motion study, about 10% of a physician's time is spent doing what's called a chart review. So a doctor will look at the patient's record and they will review that patient record, ideally before the patient walks in the room. Many times you see the doctors trying to do it after the patient's in the room with them and they're like going through their computer massively trying to read the patient record.
Right.
Not the best thing, but that is what happens. And that's about 10% of the physician's time. Because from that chart review, they have to create a list of questions, a list of problems, they call it, to talk with the patient about. Now, the patients had, they created their own chief complaint. Maybe they want to go see the doctor for a sore throat or something like that. Well, the doctor, when they look at the patient chart, they see the patient has diabetes. Maybe they have asthma. They want to ask the patient about those things. In fact, they get paid more if they do. So the doctor definitely wants to do that, but the doctor has to remember to do that as well. So what happens is doctors spend about 10% of their time doing that chart review. Then they spent about 10% of their time asking questions. Now, these questions aren't smart questions. These are standard questionnaires that are associated with a problem list. So every single hospital system or doctor's office will have a standard of care for every single potential problem. And they learn it in medical school. They have their own ones they like, or maybe they have the Mayo Clinic, as an example, would have a standard of care for every single problem that walks through the door. Well, what you end up with is the doctor asking questions that basically anybody could ask, right? And then after that's done, the doctor takes the answers to those questions to ask more questions. These are dynamic in nature. But the only purpose of these questions is really to determine what MRI, what CT scan, what X-ray, what lab, what objective information does the doctor need to complete a diagnosis and treatment of this patient? And again, anybody could ask those questions. It doesn't need to be the doctor. They need to know the answers, but they don't need to be the one to ask them. So if you keep track of the time that I just talked about, that's 45% of a doctor's time spent on a patient record is what I call pre-encounter physician clerical workflow. Chart review, standard of care questionnaires, initial consultation, dynamic questionnaires, and then prepping all of the orders, filling out the pre-authorization forms for payers, all of that activity. AdviNOW Medical automates all of that. Now, Once that's done, the physician has all the data where they can do the consultation. And this is what they went to medical school to do, right? They want to evaluate the data, assess the patient, and then relay that information to the patient, either in a consultation or maybe doing a procedure. After that, there's 25% left, right? So you have 45, then plus 30. So there's 25% of the physician's time left. They spend that time entering all of the information that they've collected into the medical record. And so that is another huge waste. Anybody can do it. The doctors are stuck doing it. Yeah. So that is a high level summary of what happens, but that is the value of artificial intelligence, as it allows doctors to be doctors once again.
That's fascinating. Yeah. And that's such a big problem in the industry. I think a lot of us hear about, completing charts after hours, like physicians are stuck doing that, but your solution at Now Medical covers the pre-encounter workflow, like you called it, and then like what happens after that encounter, which is huge. Yes. That way it's like basically the whole journey, from when the patient shows up in the clinic to when the physician is completing notes or charts after hour, which shouldn't be after hours, but you get the point. So totally. Clearly, AdviNOW, you guys are combining like the best of AI. I think I also read about your use of augmented reality. You have that really neat video on your website, like literally showing you how it's like a virtual stethoscope almost. Can you talk us through what that experience looks like for like patients and providers with AdviNOW's solution?
Yeah, so augmented reality in our system is used really to make the physician more efficient. Again, everything we do looks at exactly what the physician is spending their time on, and then we try to automate pieces of it. So that augmented reality piece allows a medical assistant to do a heart exam, a lung exam, a throat exam, an ear exam, a nose exam, really any of those measurements that you're taking images or sounds. It's really left to the physician because the physician has to interpret the images or sounds. Well, we use augmented reality to guide either the medical assistant or the patient themselves to actually place the stethoscope in the exact right place on the chest, and then for them to take a breath, and we actually listen to the lung or the heart sound. We record it so that the physician can listen to it at a different time or even a different place. And that allows them to have that objective information to diagnose and treat the patient in a very, very efficient manner.
Yeah, that's fascinating. So like they get these stethoscopes that they get to place on their chest. Like they get those ahead of time in the mail. Like how does that work?
Oh, that happens at the clinic.
At the clinic itself.
Yeah. Okay. So they come into the clinic and it's really the medical assistant who would be doing it in general. Okay. During COVID time, patients would do it on themselves. But since COVID is somewhat over, most of the time medical assistants are the ones doing it.
Got it. Okay. So they still come into the clinic, but it gives that practice the flexibility of, having the medical assistant do it, or instead of the provider coming in and doing it for each patient. It saves them.
Exactly.
Again, that 75%, is precious, right? And it's like, how can you best allocate that physician's time to the right things that they need to focus on, right? And not just reading off questions off a standard of care, or, coming in and reviewing charts or reviewing it in front of the patient worse, right? So, James, you said before that, technology is not the limitation here. What do healthcare systems and providers get wrong about deploying this type of AI and augmented reality, and how are you helping them move forward with that?
Yeah, so there's a number of problems in medical practices, and I will divide this out between large health systems and then small, what you call ambulatory practices. The large health systems really are like government agencies. Many of them are nonprofits. They're designed to not be profitable. So all of their processes are basically run by people where their profit is not their number one motivation. Now, that's not always the case, but in general, from workflows that you see inside of hospitals, that's what happens. And so you have a person responsible for patient experience. And that's all they care about. They don't care about what the doctor does. They don't care about anything else. They just want the patient experience to be great. And if they have a lot of pull in that organization, then the organization will be known for patient experience. If the physicians have the most pull in the organization, then everything will be centered around doctor burnout as an example? How do you keep doctors from doing too much clerical work? How do you limit the number of patients per day? You've got all of these motivations, which are completely different than the time and motion study that I looked at, right? I mean, when you look at it, you don't care about the individual fiefdoms. You want to make the whole better. But
Right.
if you have a government agency that has a bunch of fiefdoms set up, then each one of those fiefdoms kind of views the other as a potential limiter on their optimization. And so that organizational structure, I don't know how to fix in hospital systems, but that is their number one problem for adopting technology. Technology to solve these issues is not the problem. It's the ability to adopt it. Now, that's the number one, is the organizational problems in large health systems. Smaller ambulatory, smaller like primary care, urgent care, cardiology groups, the ones that are not hospitals, they have a little bit easier time of adopting technology. But the problem is, in these smaller locations, everything is tribal knowledge. So what is the workflow for a Medicare patient who's coming in for a cardiology checkup, but they have diabetes and hypertension, right? There's going to be specific workflows. Well, if you're in a large hospital system, the large hospital system will most likely have that standard of care documented. If you are in a small clinic chain, every doctor is going to have their own standard of care, and they're going to want it the way they want it, and they're not going to change, right? And so how do you get out of the doctor, out of the front desk, out of the nurse, what the standard of care is that you want the AI agent to automate, right? And if you don't know, then that's a problem. And so for our practices, that has been our number one limiting factor, is getting people's time to tell us what the processes are, because many times they don't know. So they have to create a committee to create the processes. And then they're like, coming to you, okay, this is what we want to automate. And then they come back and it's like, oh, we told you that, but really, now that we're using it, we want to do this. And so it ends up becoming a very, very huge limiting factor for success. So that's the number one problem in ambulatory. However, that's resolvable. So we have a partnership with one of the largest ambulatory EMR companies. They're giving us access to our clients' data, our clients' claims data, as well as the configuration of the EMR. And that allows us to actually do what we call one-click onboarding, where we can configure our system. We can infer all of the workflows in the medical practice without the doctors telling us. And so that's really exciting. That gets released later this year, and it really enables us to ramp revenue incredibly quick.
Interesting. That was a very thorough breakdown of like what are some of those limiting factors of larger health systems. You mentioned organizational problems. I love the fiefdom analogy. And then on the small ambulatory practices, it sounds like just getting time with them to understand what that standard of care is, and like what is that process like for them, and like how do they typically run this pre-encounter process, or how do they typically chart after, like what does the charting process look like today in that EHR? Do you view that in itself as a limitation? And like a lot of what I see in the market is with these AI solutions and AR that's being built into even practices, like EHRs are the focal point, right? It's like where the physician spends it's like without that buy-in of like, this works with your EHR, or it complements it, or it supplements it, it's like the road stops there almost. Like, would you agree like that's the case too? What do you guys have in store to like, I saw you nodded your head, but like, what do you have in store to double down on that? Or because it's just like, it's a big thing in the industry, and it's not talked about enough, how reliant we are on these EHR systems.
Well, I mean, so I think I'd be safe in saying that no doctor likes their EHR. No doctor likes the practice management systems that they use. They all hate them, and yet they're spending billions of dollars for them.
Yeah.
So it's really, really interesting to me. If you think about what is an EHR, electronic healthcare record, or electronic medical record, or the practice management software, those three terms are used almost interchangeably. All it is database entry fields. That's it. It's a big database with fields that have some business logic built into them.
Yeah.
And then you have to train humans on, okay, use this drop down, check this box, do this in order to get the data populated in the record the way you want it.
Yeah.
And so that when you realize that that's all it is, then it's very, very easy from a technology standpoint to be able to create an interface that automatically populates all that stuff. You just need to know how they want it populated.
Right.
So if you have access to the data, the patient record, but more importantly, the revenue cycle management piece of it, and the internal configurations, then you can infer the majority of the workflow that they do. Now, we haven't released it yet. It gets released this August. And then we have, hundreds of millions of dollars of clients that are just waiting for us to get them to one-click onboarding, if you will. And so we're excited to give this a try and see what percentage we can infer. But in our preliminary releases, we think we can get up to greater than 90% of all workflows are exactly the way the doctor wants to see it. Because when the doctor opens up the chart looks like it always did. It's just everything is pre-populated exactly like they would do it.
Yeah, that's fascinating. Yeah. No, I think, one-click onboarding would be anything that makes it easy to work with their existing infrastructure, right? I think every doctor or physician's worst nightmare is oh God, here it is. I have to go train my staff on a completely new software. And it's
exactly.
You just have to make it easy to work with their existing tools and tech. That's what they want to hear. And
100%.
You as at AdviNOW Medical, if you make that even easier for them, that's where you get all the buy-in, Yeah, because like you said, there's already millions and millions of dollars being spent on EHRs all the way at the health system level down to your practices, right? And they all depend on them, and they're necessary to get the data. But I'm trying to think of an analogy there. And you've seen other industries, but you always start with the core system and everyone builds around it. Here's one ChatGPT and OpenAI. OpenAI released these OpenAI API keys, and the customer facing tool is ChatGPT, where we're all entering data on. And every company has been able to build AI because of these open AI keys, and it's mind you, that's a different ball game with EHRs, but it's the same thing is kind of occurring now. We're at this change and inflection point in the industry where it's becoming easier to build around these EHRs. It's pretty fascinating.
Absolutely.
Yeah. And now, for the healthcare leaders listening and thinking, well, this is the type of partner infrastructure we've been missing, one-click onboarding, I'm in, how do I learn more? How can they get in touch with your team at AdviNOW?
Yeah, so you can go to our website, www.advinow.com. You can send an email to our general information, info, I-N-F-O, at advinow.com. Happy to reach out to me directly, james.bates@advinow.com. Any of those options should be able to get you in touch with somebody. Just some of the metrics. The revenue per doctor for people who adopt our platform doubles. Revenue per patient goes up on average 20% because the patients are actually being coded appropriately. The same day chart closures. So many times physicians don't finish their chart that same day, and they're metriced on this in the large health systems. When AdviNOW's used, 99% of charts are closed the same day, and doctors have zero pillow time, which means these all finished real time at the office. When you start going through each one of these metrics, the profitability going up 1,000%, which is kind of our tagline, that's just the side effect of operating a clean, tight business where you can actually have 30 to 40% profit and at the same time have a good salary. And that's what makes medical practices phenomenal businesses going forward.
Yeah. No, right on. Those are powerful metrics, and we'll definitely make sure to throw some of that in the description of the podcast and the links, areas for practice leaders to learn more about the types of impact you're having in the market.
That's fantastic. I appreciate it.
Yeah. Well, James, it was a pleasure speaking to you and having you on today's podcast. Definitely keeping tabs on your guys' journey, and I'll be on the lookout for one-click onboarding when it comes out later this year.
Sounds good, Bert. I appreciate it.